and I are thrilled to be here today and to have an opportunity to connect with all of you and talk and learn about culture change. So when we were first asked about coming and speaking today, Kate had mentioned that much of the focus would be on sort of the early stages. So how do you get started? And so, but I think we're gathering from today that a lot of folks have actually probably already started on their journeys, but perhaps there's been some frost. Or you just have some new team members that have come on board. And so we're going to spend a lot of our time focusing on that early stage, or opportunities where you have to kind of come back and re-energize as a team. So what we want to do today in the hour that we have is to first tell you a little bit about the Partnerships in Dementia Care Alliance, or PiDC Alliance, and how the approach that we've used to culture change. And then to have you, give you an opportunity to experience the dawn of a culture change process. And so we're going to have you do that by having you think about your own organizations and who the champions might be that you can pull together for your culture change process, or who else you might need to pull in, to look at how you can build strong collaborative relationships, and to give you a chance to do some comparing and contrasting of different approaches to living. So the PiDC Alliance is a research network, and it's focused really on enhancing the care and experiences related to dementia. And so we're trying to do that for all involved in the care of individuals with dementia, so individuals themselves, family members, and staff, both health-related staff and health staff from other organizations. So we've been doing this work in long-term care homes, but also community care settings. And our ultimate goal is really to enhance that care experience. So we've got a number of specific goals, but really we're trying to enhance that care experience overall. So our approach in doing this research has involved participatory action research, where we're getting all partners involved right from the beginning and involving them all the way through our process. And then using the 5 phases of appreciative inquiry. So we start with dawn, which is really that building of relationships, gathering the team together and building those relationships. Moving on to discovery, so finding the best of what is through gathering stories and sharing those stories, and we've talked a lot about storytelling today. Thinking about what the ideal long-term care home would be like, so dreaming. Designing, which involves putting a plan together to make that dream a reality. And then delivery, where you actually go ahead and work together with your teams to implement those changes. So they're presented here in a linear fashion, but they're not necessarily linear at all. And so we're going to focus today on dawn,